Hello, and thank you for coming. My name is Doogie Hauser, and I'm here representing FDAP, the Fake Doctors Association of Pennsylvania. We want to tell Dr. Oz that he is an absolute embarrassment to our profession of fake doctors. We received our medical degrees and did our medical residency at Gray Sloan Memorial. We pride ourselves on being quacks, and we do not appreciate Dr. Oz giving us a bad name. I'm here to tell you that I passed third grade science, and therefore I know that eating more vegetables will not prevent strokes. Dr. Pepper, do you have any comments on the effectiveness of vegetables to treat strokes?
Hi, my name is Dr. Pepper, and I'm a real doctor. I swear. I went to medical school at PepsiCo University. It's been a while since I've practiced medicine, but I do know that Dr. Oz's idea about veggies and strokes is a little bit fizzy. I have reviewed my notes, and I have also consulted with Mrs. Frizzle, a well-renowned educator, and I can confirm that a diet of vegetables has nothing to do with preventing a stroke. We all know through various degrees and experiences of faux medicine that cardiovascular disease, including stroke, is the leading cause of death in Americans. Everyone knows someone who has been affected by strokes. Approximately every 40 seconds, someone in the US has a stroke. It is more frequent than Dr. Oz's appearance to answer questions from his future constituents. Mehmet's foolish and frankly offensive prescription and preventative care is a slap in the face to the profession we all pretend to have an experience in. And as one of the most public members of the Fake Doctors Association New Jersey chapter, we would think that Mehmet Oz would put more care into the fake advice he gives. Thank you.
Hi, I'm Dr. House. I'm here with the Soap Opera Division of Fake Doctors of America. I wanted to speak to a serious subject, Dr. Oz, decision on abortion. As a fake doctor, we may not know everything, but we know that a surprise pregnancy can turn a person's life upside down. We know that unwanted pregnancy can mean all kinds of drama, but in real life, it's not always that fun kind. Dr. Oz wants to force all of us in Pennsylvania to carry those pregnancies to term, whether it's right for us or our families or our health. Dr. Oz claims to be a physician and an educator. That means when he supports Republican lies about the science of abortion, are people who listen. That means the damage he could do as a Republican senator, representing us in the post-Roe world, and even worse, because we know he's willing to lie. This is an issue where he's flip-flopped. For example, before he was a politician, he gave an interview about Alabama's 6-week abortion ban. It was clear he knew perfectly well that a 6-week abortion ban like Alabama could mean accepting someone to make their choice before they knew they were pregnant, or at best immediately upon learning they were pregnant, because he knows that means that he's okay with that. With Roe gone, that means he's okay with Alabama law becoming Pennsylvania. As a fake doctor, we may not know much, but we know we need a senator who will fight to protect our freedom to choose, our power to write our own stories.
Hi, I'm a reporter. Dr. Seuss, would you go to Dr. Oz as a medical consultant?
I would not. I would not go to Dr. Oz for advice. I would not trust his recipe for ice. I would not trust him to drive safely down the turnpike, or with medicine, health tips, diet, and the like. I would not ask him for help or more. I would not ask him at the Jersey Shore. He is not a pro. He is not a rookie. I would rather take advice from Snooki. I've checked all Princeton. I've checked with Rutgers. They all agree he is one dumb mother.
That's your time. That's your time. Peter, would you like to give any word on this?
Well, in 2015, a group of nationally prominent physicians called for Dr. Mehmet Oz to be removed from the faculty of University of Columbia's Irving Medical Center due to his disdain for science and evidence-based medicine, and, quote, manifested an egregious lack of integrity by promoting quack treatments and cures in the interest of personal financial gain. Dr. Henry Miller, one of the aforementioned physicians, has recently stated that the concerns over Dr. Oz were never about free speech, as Dr. Oz has tried to state previously, but instead, quote, It was about an unethical grifter whose claims and pronouncements were not supported by science and were injurious to consumers in the interest of financial benefit to Oz himself. That constitutes professional misconduct. It should be noted that as of April 2022, Dr. Oz has been quietly scrubbed from the faculty listings of Irving Medical Center. Dr. Mehmet Oz recently commented on the health of his political opponent, Lieutenant Governor John Fetterman, making an inappropriate and unfounded statement regarding his health as pertains to the stroke that Lieutenant Governor suffered in May of this year. Oz made the statement that, quote, Fetterman probably would not have had a stroke if he had ever eaten a vegetable in his life. Oz's senior communications advisor to his senatorial campaign doubled down on this comment, adding, quote, maybe he would not be in a position, Fetterman, of having to lie about it constantly. Another unfounded comment. This is a scurrilous insult hurled at a political opponent over the very serious and well-known cerebrovascular accident John Fetterman suffered during his campaign. One that could have had much more serious, if not fatal, outcomes. What makes this even worse is that Oz is a cardiovascular surgeon, someone who should know quite well how devastating a stroke can be, and that one does not have a stroke because of an imagined failure of diet. This callous and flippant commentary goes against the ideals of patient care and compassion, that a physician should observe commenting on the health of others, and certainly goes against our training as doctors. But given his history, why is Dr. Oz's behavior shocking? Well, given his history, it isn't, nor does it surprise us in the medical field. Dr. Oz's professionalism and ethical qualities have long been called into question by his fellow physicians. Real Doctors Against Oz is an organization of Pennsylvania physicians who believe Dr. Oz has forsaken his ethics as a physician and that he is simply not trustworthy. Having, quote, exploited the hopes and fears of his viewers by promoting unproven, ill-advised, and at times potentially dangerous treatments. In this same group, Dr. Valerie Arkush has stated, quote, no real doctor or a decent human being, to be honest, would ever mock a stroke victim recovering from that stroke in the way that Dr. Oz is mocking John Fetterman. It's disgusting. As a real physician, I wholeheartedly agree with Dr. Arkush's comments. This behavior is unacceptable from the perspectives of professional ethics, the compassionate regard for the ill and injured, and the maintaining of a level of polite decorum. This base behavior exhibits is telling. If he shows such callous disregard for his training in science and medicine, as well as the ethical precepts of his medical training and prior years of experience before he became a talk show huckster and purveyor of fraudulent snake oil, how can he be trusted not to grift the voters of Pennsylvania as a U.S. Senator, given his willingness to pursue profit for his own benefit and over the needs of the citizens?
Ma'am, as a fake reporter, I have to ask, do you think your baby's a more reliable doctor than Dr. Oz?
What do you think? What do you think?
Are you a more reliable doctor than Dr. Oz, sir? I'd say that's a resounding yes.